This, as you can see, is a very soft cataract. I'm just going to do a 2.2 mm phaco in this case, and I'm demonstrating how I went about it. There's my 2.2 incision, and then both the side port incisions as well. Obviously this cataract doesn't need any staining. I go ahead with my cystitome, and I'm targeting the 5.5 mm rhexis here. Sometimes you can be fooled by these cataracts. The rhexis can be a little difficult because there is no counter pressure when you're doing the rhexis. Sometimes may be easier to do with the forceps, but however, I'm not having any trouble. So continue with my bend 26 gauge needle. That's it. Once that's done, I go ahead to my hydrodissection. And there you can see the beautiful wave going across. Just do another small hydrodissection and one pole prolapses, and you can see how I am trying to help it out. This is my famous, my most favored technique of a single pole prolapse phaco emulsification, and you can see, of course, the whole thing has come out. Normally I'll keep one pole in and one pole out, doesn't matter. Such a soft cataract. I aim to carousel this cataract, and let's see whether it goes off well. So, and that's it. My parameters are 400 millimeters mercury, 40 ml AFR, very low phaco power, and you can see it's beautifully carouseling the epinucleus, and now that small hardcore nucleus. So probably using about 30% phaco, 30-40% phaco power, but my AFR is 40 and my vacuum is 400, as already mentioned. So once all the nucleus, epinucleus is done, I think about targeting the cortex also with the phaco probe. I do get out some cortex. However, it's taking a bit of time. So I decide, rather than going with this, might as well switch over to my usual method of bimanual irrigation aspiration. But then, even with the bimanual, I am having it is time consuming, which means this cortex is pretty sticky, pretty adherent to the capsule. Or my parameters, my irrigation aspiration parameters should be stepped up much more, which I only do a bit later. However, although time consuming, it's a safe procedure. So just going bit by bit. There can be two problems. Probably my aspiration handpiece is not that great, or the aspiration line itself, there may be some problem. But here I've increased the parameters, and you can see how fast it's coming. So that was the whole issue. It was on very low parameters. Actually I just stepped up the vacuum and the AFR, and it's fine now. This part I would advise beginners to switch hands and not be impatient like me. Switch hands and do this part. It's not worth getting a PCR at this stage. I then put in some HPMC. and inject my this is a Hoya. It goes in through a 2.2 it can go in fact through a 2 mm incision. So this is a 2.2 mm incision. It goes in very easily, and I am targeting for it to go directly into the bag, which it has. And all I need to do now is to remove the HPMC, put in my intracameral antibiotic, just check the wounds and conclude the surgery. Thank you so much for watching.